The governor of New York has eased guidelines for the mandatory 21-day quarantine of medical workers returning from West Africa announced on Friday. Now, medical workers who have had contact with Ebola patients will be quarantined and checked by health workers at home. The governor also stressed that the state would pay for any lost compensation.
If their organization does not pay for the 3 weeks, Doctors Without Borders does. But if their organization does not pay for the 3 weeks, we will. If their employer is going to put them at a disadvantage because of the 3 weeks, we will talk to the employer to explain that situation if necessary.
And Sunday's announcement came after criticism of the treatment of the nurse Casey Hickox, who was quarantined in a New Jersey hospital isolation unit after returning from Sierra Leone last Friday, even though she said she had no symptoms and tested negative for Ebola. The nurse described the quarantine as a frenzy of disorganization and says she is planning to sue the federal government for violating her civil rights. She said she was questioned by officials in protective gear. The new policy imposed by Illinois together with New York, New Jersey, and Florida requires a 21-day quarantine for all health workers who have had contact with Ebola patients in West Africa.